So my medication for today's injection is Lantus, which is otherwise known as insulin glargine. So looking at the MAR here, we see that for our patient Jake Nursing, under his scheduled medications for Lantus insulin, we have a signature beside the transcriber and a signature beside the nurse. So it's been double verified. So I don't need to compare the MAR here with the MD order sheet as part of our first check. As well, I have no doubts about the accuracy of the transcription. So I can go right to selecting my vial of Lantus from my stock supply and comparing the label of the vial with the MAR here, just to make sure I've selected the correct vial. So as part of my first check, I have my right medication, Lantus insulin. I have my right dose, 10 units. I have a unopened 10 milliliter vial here with 100 units per milliliter concentration, so I can make that dose. I have the right route, so subcutaneous for subcutaneous injections only. The right time and frequency is every AM at 0800 hours. The time is now 0750, and it says here that it hasn't been given yet. So we can begin, we are within the time period where we can begin preparing and administering the medication. As well, on the diabetic flow sheet here, I have an AccuCheck done at 0740 with a 10.8 blood glucose reading. So that also falls within the time where I can begin preparing and administering the medication. So looking here, I have an unopened vial here, and it's not expired. So you'd want to check the expiration date. When insulin is open, it expires 28 days after being open. So when you open it, you want to put a label there saying the date it was open. And then if you are using an open bottle, just checking that label just to make sure when it is expired. So on our MAR here, our patient I see has no known allergies or no known drug allergies. So the contents of this vial shouldn't conflict with any allergies. Obviously, if they're getting this for the first time, just making sure, monitoring for any signs of hypersensitivity. So I'm going to perform hand titrage and tell you a bit about the calculations for the dose or volume of the amount we'll be drawing up. So we're using a Vantage Point insulin syringe, so specifically for insulin. It's a, and it's measured in units here on the syringe. So we're not actually looking to draw up milliliters visually, we're looking to draw up units. We're actually just going to be drawing to that 10 unit line. If you did want to know how many milliliters you were drawing up, you would put the doctor's dose for the dose at hand times that stock. So the 10 units over the 100 units as part of the concentration times that 1 ml stock to equal 0.1 milliliters. But again, you're not drawing up milliliters, you're drawing up units, you're visually drawing up units. So it's safer to think of it in terms of that. So now I'll tell you a little bit about Lantus. So Lantus, otherwise known as insulin glargine, is an anti-diabetic and long-acting insulin. It works to decrease blood sugar by transporting glucose into cells as well as converting glucose to glycogen. It is used for the treatment for insulin requiring diabetics, such as the type 2 diabetic in this scenario. Common side effects include dry mouth, blurred vision, redness, and itchiness at the injection sites, lipohypertrophy, which is the thickening and accumulation of the fat cells, which is why, as a result of repeated injections in the same area. So that's why you're wanting to rotate sites and rotate within the sites. And although the risk for hypoglycemia is low for Lantus, because it does not have a peak, it is still important to monitor for the signs of hypoglycemia, as well as educate the patient what they may experience if they're going into a hypoglycemic state, such as chills, anxiety, hunger, confusion, appearance of pallor, dizziness, and sweating. Monitoring blood sugar after insulin injections may be unique for each patient in the sense of how often you check it throughout the day, as some may require their blood glucose to be checked more frequently throughout the day, and some may be taken less often. Other facts about insulin is that it has 1 to 3 hour onset. Lantus should never be mixed with other insulins. Safe dosage very individualized, so it's dependent on various factors with the patient. It is taken once a day because it's 24-hour duration, and it should be taken at the same time every day. So in the morning at the same time, morning at the same time, not going from morning to evening to afternoon. Prior to administering insulin, the assessment we've done beforehand is checking their blood glucose reading as part of the AccuCheck, which is indicated on the diabetic flow sheet here, just so we know what their current blood glucose reading is. Looking at the adult parenteral drug monograph for any important information and preparation instructions, we see that insulin is a high alert medication. It says it undergoes an independent double check and visual verification prior to administration, so you want to be really precise with the dose you draw up. So that's partly why we're getting that a second nurse to check, just to make sure we've drawn up the correct amount and our process has been correct. It says that it can be given subcutaneously and it may be administered by a student nurse. Looking for other information about it, again, it says for the dosage, subcutaneous doses are highly variable based on blood glucose levels, and again, like I mentioned before, it's very individualized for the patient. Subcutaneous administer undiluted. Potential hazards would be that hypoglycemia, so looking for the signs and symptoms of that. And insulin glargine should not be mixed with other insulins. Okay, so now we'll begin preparing the medication here. So I have that. So in terms of the needle and syringe we're selecting a Vantage Point insulin syringe. So like I said before, it's specifically for insulin. It's a 1 milliliter U100. So there's 100 units written on the syringe here, so we'll be drawing up to the 10 units, so this is an appropriate one to use. It's a 29 gauge times ½ inch needle, which is the gauge and needle length appropriate for subcutaneous injections, so we'll be giving it to the subcutaneous tissue. The best sites are buttocks and thighs, abdomen, the backs of the arms, and the subcutaneous tissue. I'm going to be choosing the right lower quadrant of the abdomen for today's injection, but just making sure that that fits within the parameter of subcutaneous injections. So I'm going to start preparing. I have my vial here. I'm going to crack off the top here and use an unopened alcohol pad to clean the top there for 30 seconds in circular motions. Just for the interest of saving time for this video, zoom forward 30 seconds. So pretend I was doing that for 30 seconds. That's going to be allowed to dry just because you don't want alcohol getting into the vial when you're injecting the needle tip. So opening that up, going back to the top, remove the syringe there. So I'm going to calibrate it to the proper volume and dose for drawing up. So that was the 10 units, making sure it's at that 10 unit line. So we've drawn back air, so that will be injecting into the top there. So now that that's dry, take that off and inject the air, and then drawing back to the 10 units. And you want to make sure there's no bubbles in here just because it's such an exact, it has to be such an exact amount. Yeah, so if there was a bubble at the top, just at the top there, you want to make sure it's above the first line there, and it's taking up less than half. So it's really important not to make sure you have no bubbles in there. So that's the 10 and there's no bubbles. Use a sweep method there. Excellent. So we have the 10 units drawn up with no bubbles there. I'm going to use, so we have, so you immediately prepare your label. So I have my patient Jake nursing. The drug name was Lantus, insulin glargine. The dose was the 10 units, and the volume was that 0.1 milliliters, but again, you're not really looking at the milliliters specifically. Concentration was 100 units per ml. Date and time. So by the time it was actually prepared, just because we took the time to talk about it, the current time is 0755, and is February 7th, 2021, 0755 hours. And my signature. Okay, so I'd immediately attach that. I don't have tape in this household, unfortunately. I don't have tape, so just pretend it's, yeah, just pretend it's taped there. So I'm going to use, the camera to show you. Just that I've drawn up the 10 and that there's no bubbles and that the label is correct there. So there's that there. Okay. At this point, you'll be doing your second check. So just comparing the MAR with the vial label here, with the label attached to the syringe, with the syringe, the contents, the meds within the syringe. So I have my right patient, Jake nursing, a right medication, Lantus insulin. I've drawn up Lantus insulin. The right dose, 10 units. I have a vial that was able to make the 10 units. I have 10 units right here. Just visually verify that you have 10 units and no bubbles there. Right route, subcutaneous injections only. I have a syringe here that being given subcutaneously. The right time and frequency is every AM at 0800 hours, and it hasn't been given yet. And the time was now 0755, like we mentioned before. So it's the time window that we can be we would have prepared, and we can administer the medication. So I'm going to get another nurse to do that second check, just to make sure I've drawn up the correct amount, my process has been correct. So she would check that. So putting this away, I'm never leaving my meds unattended at any point. I'm going to put this back in the stock supply, labeling the day that it was opened, just to know now that it's open, it can't go 28 days past that. Yeah, nurse would check that. Never leaving meds unattended. I would take my tray, leave the med room. So now that I'm entering the room here, with my tray, I'm performing a safety check, just making there's no hazards on the ground, the patient's not in any distress, the equipment around them is functioning properly, so that's part of my safety check and general survey. So I'm just going to sit here for the purpose of this video, just so you can see my face. But I start by introducing myself with my designation. So hi, my name is Sarah Kennedy. I'm a student nurse in the University of Manitoba. Are you able to, I'm just here to perform your medication administration today. Is that okay? Good. So are you able to tell me your name? You want them to verbally tell your name and just make sure that verbal name matches what you have on the MAR here. And are you able to tell me your birth date? Good. And you just want to make sure that birth date matches the MAR as well. I'm just going to check your name and armband there. So just making sure that the name on the name band matches the MAR here as well, and that the FIN and the date of birth also match. So those unique identifiers. Good. And are you able to tell me if you have any allergies? No? Okay. Good. That's what I have on my record here as well. So you just want to check that they have no allergies on their MAR now. And that they verbally can tell you that they have no allergies, or if just match up with the allergies. Excellent. So I just want to just check over your medication again before I administer it, if that's okay. Okay, so this is where you do your third check. So you're comparing the MAR here with the syringe with the label there. So I have my right patient, Jake nursing. I have my right medicate, and they said they were Jake nursing. I have my right medication. So the Lantus insulin, and I've drawn up Lantus insulin. The right dose, 10 units. I've drawn up 10 units. The right route, subcutaneous. This needle can be given subcutaneously. Right time and frequency is every AM at 0800 hours, and the time is now 0800 hours. So I can give that, and it hasn't been given yet today, so that's appropriate. So I just want to provide a bit of patient education. So I'll start by explaining the procedure. So today I'll be administering your injection of Lantus. They're probably familiar with the procedure just because it says here on the diabetic flow sheet they've gotten insulin before, but I'm just going to be injecting the needle into your abdomen today to give you the insulin. So I'll be giving the right lower quadrant of the abdomen, so you might feel a little pinch, but it shouldn't last too long. So Lantus is otherwise known as the long-acting insulin glargine. The insulin is an anti-diabetic drug used for your type 2 diabetes, and it works to lower your blood sugar. Common side effects include dry mouth, blurred vision, redness, and itchiness at the injection sites. And although Lantus has a low risk associated with hypoglycemia, so that's where your blood sugar is getting too low, it is important to be aware of the signs that you may be having a hypoglycemic reaction. This would include being aware of any chills, anxiety, hunger, confusion, dizziness, and sweating that you may be experiencing, and to let a healthcare professional immediately so that we can work to get your blood sugar back up if you do experience that. Like I mentioned, we'll be giving it into your lower part of your abdomen there, so the right lower quadrant. And assessments we do beforehand. So at 7:40 a.m. we assess your blood sugar to be at 10.8, which is high enough value that the insulin injections are safe, and it's not too, and your current blood sugar wasn't too low where it wouldn't be safe to administer that. Okay, so now that we've done that, I'm going to be choosing the right lower quadrant of his abdomen today. So that'll be just right here into the subcutaneous tissue. Like we mentioned before with insulin, best places are the backs of the arms, the buttocks and the thighs, and the abdomen, into the subcutaneous tissue. So I'm choosing the right lower quadrant. Just want to make sure it's at least more than 2 inches away from the belly button, and that you're not going over any scars or moles or anything. You want to make sure that the area is inappropriate. You can inject appropriately into the area. And part of that was avoiding the lipohypertrophy. So just being aware of the sites that have already been done, and just kind of spread it out a little. Okay, so my right lower quadrant today is a sock, and for the injection today, if I was able to draw up 2 inches of the tissue, I'd be coming at a 90-degree angle to inject. If I was able to draw up 1 inch of the bunch up 1 inch of the tissue, I'd be coming at a 45-degree angle. So for the purpose of this video, I'm going to say I was able to draw, or I'm able to bunch up 1 inch of their tissue. So I'll be coming at a 45-degree angle. So I'm going to put on clean gloves. And I'm going to use an unopened alcohol pad to clean the area using circular motions outwards. Just for 30 seconds, just for the purpose of this video, 30 seconds, and just moving from that inward to the outward. So circles, circles, circles. Okay, so I'm going to dispose of that, allow that time to dry. So I'm going to just explain to you what I'll be doing with the syringe here. So insulin syringes have a vanish point, so that'll be, it feels like an additional click when you inject it, so just making sure that's activated upon injection. So that'll make sure that the needle's retracted and that all the contents of the vial of the syringe are within the tissue. So once it's retracted, that's when I can release my grip on the bunch of tissue. Yeah, so making sure the cotton ball is nearby. Remove the cap there, bunching up that 1 inch of the tissue, 45-degree angle, stabilize, slowly inject, activate the vanish point. So at this point, that's when the needle's retracted and I can release that. Cotton ball on. There wouldn't technically be this needle tip here, but it is right now. So that cap goes back on. Dispose of that into the sharps container. I'm not massaging the sites. Removing the gloves here, disposing of them, and performing hand hygiene. What we'd monitor for that afterward is just making sure that those therapeutic effects of the drug are working, so that is working to lower their blood sugar, and that just those signs associated with hyperglycemia, that it was, you don't want to see those because you want to make sure the drug was working. So just making sure that they're not showing polydipsia, polyuria, polyphagia, and that the blood sugar is lowering. You would monitor the blood sugar throughout the day. It's how many times is dependent on the patient. It's highly individualized. And you'd also want to be monitoring for, it's low risk with Lantus with the hypoglycemia, but just making sure it's not going too low, of course, and we've educated the patient on what to look out for. So writing down we're still in the room, writing in the MAR here, we gave the insulin at 0805, and I'm going to put my initials there, and then my designation UMSN2. And then on the diabetic flow sheet, we'd also do here, we've given 10 units, glargine, insulin, subcut. And then the time, 0805, given by SK with my designation UMSN2, and then comments, sites, that right lower quadrant, just because, again, we want to make sure that we're rotating sites and such. Okay, so that would be what I write on the MAR here, or on the MAR and the diabetic flow sheet here. So before leaving the patient's room, I just want to make sure the patient's safe and they're in a comfortable position, that there's that their bed is lowered, the brakes are on, the railings are up except for 1 foot railing is lowered, that they have their call bell within their reach, they don't need anything else, they're no distress. So yeah, then that was part of our exit safety check. Leave the room. In terms of assessments or documentation for the assessments we would have done beforehand, part of that was written on the diabetic flow sheet here with the blood glucose reading we would have done before, because you always want to make sure you're checking the blood glucose beforehand. Other documentation notes we could write about the fact that we educated the patient on signs and symptoms to look out for hypoglycemia, because that's important to be aware of with insulin.